I've been admitted to the hospital. So, why am I still in the ER? Hello, and welcome to Beyond the Stethoscope. I'm your host, and today I want to talk about something that confuses and frankly frustrates a lot of patients and their families. It's the moment. You've been told you're admitted to the hospital, and naturally you think, great, I'm getting out of the ER and going upstairs to a hospital room. But then something unexpected happened. Hours pass, sometimes many hours, and occasionally even a full day, and you're still in the emergency department. The question becomes, if I've been admitted, so why am I still in the ER? And the answer lies in something most people have never heard of. It's called ER boarding. When a doctor or a nurse practitioner or a physician assistant tells you that you're admitted, this means a decision has been made that you need hospital level care. Maybe you have pneumonia and need oxygen and IV antibiotics, or maybe you have chest pain that needs monitoring, or possibly a stroke evaluation. The decision is made. Orders are written in the computer. You are officially an inpatient. But one thing may still be missing: a bed upstairs. Hospitals run close to capacity much of the time, and some days the hospital might be 90 or 95% full before the day even begins. Beds open, but only when another patient is discharged, transferred, or moved to another level of care. Until that happens, there simply may not be a place to send you yet. So you wait. And that waiting happens in the ER. But beds aren't the only piece of the puzzle, and hospital beds are not interchangeable. An example might be the patient who needs heart monitoring needs a telemetry bed, or someone critically ill may need an ICU bed, while other patients may need isolation rooms. So even if a bed opens up somewhere in the hospital, it might not be the right kind of bed for you. Now, let's add another factor most people never think about: staffing. A hospital room can't safely open unless there are enough nurses to care for the patients assigned there. So if staffing is tight, which it often is, then some beds remain temporarily closed, even though the physical room exists. And then there is the simple logistics of turnover. And by that, I mean, when a patient leaves a room, environmental services must clean it, equipment may need to be replaced, and the next care team must be assigned. And it's only after all of that happens can the room be released for the next patient, and that takes time. Meanwhile, the emergency department continues to receive new patients, the heart attacks and the strokes, accidents, and the severe infections, people who truly do need emergency care. But the ER now has admitted patients waiting for beds. So the ER starts functioning as something it was never designed to be: a temporary hospital ward. And this is what we call ER boarding, because patients are technically admitted, but physically still in the emergency department. To patients and families, this can feel confusing. You might think, did something get forgotten? Maybe the hospital lost my bed. Maybe they changed their mind about admitting me. In almost every case, the answer is no. What you're really seeing is the hospital system working through capacity. Doctors, nurses, bed coordinators, and case managers are all trying to move patients safely to the right place. Sometimes the system moves quickly, and other times it takes longer than anyone would like. If you or your loved one ever find yourself admitted but still in the ER, here are a few helpful things to keep in mind. First, you have not been forgotten, so your care team knows you're there. Second, the delay usually has nothing to do with your specific care. It's about hospital capacity and logistics. And third, everyone involved is trying to place you in the right bed, not just the first available space. Because where you go matters for the type of care you need. Healthcare is a complicated system with many moving parts. Most of that complexity happens quietly behind the scenes, but every once in a while, patients get a glimpse of how the system actually works, and ER boarding is one of those moments. It isn't ideal, and it isn't what anyone prefers, but understanding why it happens can make the experience a little less mysterious. My name is Arn Facklam, a nurse practitioner and fellow of hospital medicine, and this has been Beyond the Stethoscope, a place where we pull back the curtain on how hospitals really work, because healthcare makes a lot more sense when you can see what's happening behind the scenes. Thanks for listening, and I'll see you next time.